All right, good evening, everyone. Welcome to Monday Night Spark. It is Monday night, so we have our Spark live stream every week, 8 p.m., coming here to get your education. Tonight's topic, we are going to be talking about what you should do after you roll your ankle. So what I need you to do right now is I need you to tag a friend who has either sprained their ankle or is a dancer, dance mom, gymnast mom that is out there, because the ankle sprain is the most common dance-related, gymnastics-related injury that there is out there. So I see a lot of these in the clients that I help. Or if you are an active adult, active individual, any athlete who has sprained their ankle, or you know a parent who has a child that has sprained their ankle. So you don't just sprain your ankle by sitting on the couch doing nothing. You are pretty active when you sprain your ankle. So it is most common in athletes out there. So if you can tag them in this video, that will help reach more active people, as well as if you're on the live right now, just type in live, team live. It will just help me know that you are here on the live stream. And if you're watching this on team replay, thank you for watching the video. Just type in team replay so I can give you a shout out. All right, I want to get as many people, we want to help as many people as possible. So by you liking and loving this post and tagging your friends in it, then it will help more of them see this on their news feed. So I am very excited about this topic. I'm actually rolling out a whole series this week looking at the specifics on ankle sprain rehab, as well as one of my important topics is prevention. So the big thing is I like to prevent injuries and make more resilient athletes so they don't get injured and suffer ankle sprains. So I will be going into the details of all this content this week, specifically for dancers. So this week is Dance Recital Week. So I wanted to roll out this topic for this week at Team Adam. So at the Academy of Dance and Music in Wallingford, we have our annual dance recital this weekend. So I wanted to kind of theme all the content specific for dancers this week. And I'm collaborating actually across the pond in France with someone that I met on Instagram. So shout out to you, Corps de Ballet, and Ondine. And she has been very helpful for looking at specific ballet content that has helped many of the dancers I work with. And I've helped her answer some rehab specific questions for dancers. So we have this collaboration going this week, really looking at this topic of ankle sprain. So I hope you guys kind of stay tuned for the post. If you're interested in ankle sprains and or keeping dancers healthy, then that is what we have planned for you. So I hope you all had a great Mother's Day. I know I did. Spent it with my mom and my wife and my two girls, and we had a great family day together. So shout out to all you moms out there, because you guys never get enough credit. I see all of you moms, all your dance moms, or your gymnastics moms, all the runners out there, that you guys do so much for your kids and you never take care of yourselves. So I oftentimes have to educate you that your health is important too, because you just kind of work and you take care of your kids and you don't think about your own health. You save that to the last. So hopefully you did think about yourselves yesterday and you had a great day with your families. So let's get into the first topic. First topic here, guys, let me know if you're on here on the live again. First topic is going to be, how do you know when you do roll your ankle? So you roll your ankle, you have pain, it starts to swell up on you, and you're wondering, did I sprain my ankle or did I possibly break my ankle? So is it broken? So what we utilize for this, and this is a common scenario, again, that I am in that role as a physical therapist, being a mobile physical therapist, meaning I'm on site. So I'm in gymnastics gyms, I'm in a gym setting, I'm in a dance studio, and oftentimes you will get someone who has injured. So I'm having to often kind of triage these patients. So the thing that I utilize is what we call the Ottawa ankle rules. So what that simply is if you have pain on the outside of your ankle after you roll it, if you are unable to take steps and walk on the ankle right after it occurs, then what we want to do is we want to send you out for a radiograph. So they take an x-ray. So they take a picture, x-ray, make sure that outside bone, after you roll it, is not broken, because that is a possibility. When you roll your ankle out to the side, it is possible that you not only maybe sprain the ligaments, but you could have fractured the bone, the fibula bone on the outside of your ankle. The other thing is if you have bony tenderness there, as well as pain on the outside, then that would be the indication to go get an x-ray. So I know that's always something that people wonder about, like, what do I do? Do I just kind of ice it, elevate it? If you're not able to put weight on the foot, it's just too painful. Or if it's really tender on the outside, you can kind of touch on that outside bone, then you definitely want to get an x-ray just to rule out a fracture. So that's like the first foremost thing that you need to do, is you want to make sure it's not broken. All right. So again, guys, if you are coming here on the live, just type in live. If you're on Team Replay, then hit Team Replay, type that in, because again, the more that you kind of love this post, and the more comments here, it enhances the engagement. So then we can get this in front of more people's news feeds. As they're scrolling, they'll be able to see this post, and we'll be able to help more people. So Erin, thanks for joining. Gabriella, thanks for joining. Mob Truths, thanks for jumping on there, and thanks for tagging. Appreciate that. Thanks a lot, Karen. I appreciate all that. Caitlin has joined on. Thanks, Caitlin, for jumping on here. All right, so the second thing that we want to talk about is sometimes when I see people who sprain their ankle, they're wondering, like, do I need physical therapy, or do I just let it rest? Do I just kind of let it rest, ice it, and don't do my activity, don't do my sport for a day or two? So that I highly do not recommend in most cases. If you are a chronic ankle sprainer, so you tend to roll your ankle a lot. This has happened many times before. Sometimes I'll see that chronic ankle sprain person, and they roll it, but they don't really do damage because they've rolled it so many times. Then maybe they might not need rehab for the initial phase, but they need rehab to try to work on the things and prevent it from reoccurring again. So you don't want it to keep on reoccurring. So, but in general, I would recommend an evaluation by a physical therapist, because what we would do is we would classify the exact stage of the sprain. So there's 3 different classifications, and I'm going to go into that in future posts this week. I'm not going to bore you with that now, but on diagnosing and proper classification to determine what is the prognosis, meaning how long is it going to take your ankle to heal. So that's important to stage and figure out how long it's going to take to heal in order to know what is the best treatment. But in general, real quick, you're going to need to focus on decreasing the swelling in your ankle, and then getting your range of motion back, so getting full movement in the ankle. And then you're going to need to work on strengthening the muscles in and around the ankle, as well as tying that into function and strengthening the whole lower chain. So strengthening your whole lower leg muscles, your hip muscles, your knee muscles, as well as the foot and ankle muscles. So actually in today's post that I did share on Instagram, we talked about anatomy and how the hip plays a role in the ankle and foot mechanics. So the hip will play a role in ankle foot mechanics. So it is important to not only look at the foot and ankle, but also look higher up at the hip, because a lot of those muscles control what happens down at the foot and ankle. All right. The most common thing, though, guys, that I'm starting to see this a lot in my clinical practice is you sprain your ankle, you go to the ER, the ED, you get an x-ray, the emergency room physician gives you an air cast or a walking boot and says, wear this for 2 or 3 weeks, and then just take it off and start walking again. So I've seen a lot of these people who come in immobilized for a while, haven't started any physical therapy, haven't gotten the proper kind of management at that point, and now they have pain, or they have continued pain, and I see them weeks later because their joints are stiff. So their joints are stiff and locked up, so now they're lacking mobility. And it's actually some simple techniques that a physical therapist can do, some manual trained physical therapists, of either manipulating the ankle, mobilizing the ankle, restoring that movement pattern to help your mobility so you don't have pain anymore. So that's another kind of common scenario that I see after an ankle sprain is someone who's been immobilized too long. They didn't do anything in that initial phase, and they weren't promoting movement and mobility. And then their ankle gets stiff and locked up, and then they have pain, and then they can't return back to their sport because of the pain. So think about that, guys. If you immobilize something and you lock it up in a boot or an air cast for a certain number of weeks, then things are going to be pretty stiff after, right? So does that make sense? If that makes sense to you, type it makes sense. But that kind of makes sense to me, right? Especially as you age, then your recovery and bounce back after being immobilized, it doesn't bounce back as quick. So it is going to take a little bit longer, or you might need a little assistance with some hands-on manual therapy to the actual ankle that you can't do on your own in order to actually get that full mobility going. So those are the reasons why you do need physical therapy after your ankle sprain. All right. So again, guys, if you're watching here on Team Replay, just type in hashtag Team Replay. So we got a little guest here for our Monday Night Spark. You gonna come in, or are you gonna just stand there like a creeper? Who's this? Who are you?
I'm Gabby.
Gabby is making her appearance on Monday Night Spark. So what's this week? What's going on this week?
Well, Friday we start our recital, so we hope you come to our recital. Yeah, I have all my dances that day, and then Sunday's the private show, and yeah.
Yeah. So you got your end of the year recital.
Yeah.
Very exciting. Can't wait to see you on stage. You'll be fantastic. Anything else you want to tell people about ankle sprains?
Just if you injure it, and after you go to the doctor, get your boot, I would recommend going to my dad. He's an amazing physical therapist. You know, when me or my sister Liv or my mom, we get hurt, or the other Mother's Day, actually, yesterday, my mom, she woke up with a stiff neck, and my dad just mobilizes it, and click, it's nice and better. So he does a lot of great stuff for people, so you should thank him.
And I did not pay her to say this, okay, everyone? So thank you. A little on-site testimonial. Wasn't expecting that on the Monday Night Spark Live. So thank you.
Go join the Monday Night Spark Live.
Oh, man, you're too much. So, all right. Anything else you want to say? No? All right. Cool. Hopefully you're going to prevent ankle sprains, right? So you're going to work on strengthening your ankles?
Yes.
All right.
I'm going to do some stretches. I think I should.
And strengthening. More important, strengthening than stretching to prevent ankle sprains. All right. So the last topic that we are going to talk about. Thanks, guys. You can stay for the rest of the way. The last topic I wanted to see is how do you prevent ankle sprains? So not only treatment is important, and physical therapy can help with treating ankle sprains, but preventing ankle sprains is even more important, right? Especially for those that have rolled it once, you're more likely to roll your ankle again so that you have a greater chance because the ligaments have been overstretched. Usually you have loose ankles. Typically, we talked about the situation where there's hypomobility in your ankle, but if you have loose ankles, then you have a greater chance of it happening again. So as Gabby was alluding to before, it's not so much stretching that you need, but it's stabilization, strengthening, or what we call neuromuscular control. So it's really using your muscles in your legs, not only the ankle and foot, but also your knee muscles, so similar to your quads, but then also your hip muscles are even more important. So the outside hip muscles, your gluteus medius muscle, as well as your hip rotators can help control movement of the foot and ankle in and out. So going to pronated position or supinated position, so where it kind of rolls in or rolls out. So lower leg muscle strengthening, your everters or peroneal muscles on the outside of the ankle is going to be very important. And most of these exercises are not only going to be done with a TheraBand in a lying down position, but they need to be done with you standing on the ground, foot on the ground, actually working on that neuromuscular control, that balance, and kicking in those muscles. So doing those different functional movements is going to be really important to help retrain your muscles how to stabilize that ankle. And then the other thing, besides that kind of neuromuscular control and balance that you're going to be really working on, is plyometric training. So if you do a running sport or if you jump at all in your sport, then you have to train your muscles plyometrically in order to stabilize your ankle when your foot lands on the ground so it doesn't roll. So that's the importance of training with plyometric exercises. So make sure you include those. That are going to be very important for preventing future ankle sprains. All right, so if this video was helpful for you, then I definitely would like you to like and love this video. So again, more people will be able to see it. This is a quick one, a short one. I wanted to jump on here real quick. Dance recital week again. Dancers, gymnasts commonly sprain their ankles. Hopefully some of this information was helpful for you. If it was, then definitely type in, let me know what was helpful for you. That will help me gear some more of the future content on some future Monday Night Sparks. I hope everyone has a fantastic week planned ahead. I know we will have a busy dance week planned ahead of us, and I can't wait to see all the numbers on stage at the recital this weekend. So again, this has been Dr. Duane Scotti, physical therapist with Spark Physical Therapy, located right here in Wallingford, Cheshire area, doing on-site visits, so mobile, either at your training facility, in your gym, at your dance studio, or even making house visits as well. So if you're interested in any of the services that I provide, I highly recommend you check out sparkyourtraining.com. You will find all the information right there on the website, and I hope you all have a great night. Bye.
Bye. Did it work?